Over the past 25 years, Karma Bass has worked with healthcare leaders across the country on governance, strategic planning, philanthropy, policy, and board effectiveness. Prior to launching her consulting career, she served as a president and CEO of Alliance Healthcare Foundation in San Diego, where she reported to an independent 11-member not-for-profit board. And notably, Karma spent 10 years at the Governance Institute, where she led its member services, research, and publications. Karma is board certified in healthcare management and holds a master's degree in public health with a focus on health services administration from San Diego State University. Karma is no stranger to AWPHD and WISHA. I know many of you have seen her before. We are so happy to have her back to share some of her knowledge to help our PhDs be high-functioning boards. So with that, I'll turn things over to Karma.
Wonderful. Thank you so much, Matt. And what a pleasure to be with you all this afternoon. Thank you for taking an hour out of your busy lives to join us today. I'm Karma Bass, as Matt mentioned, and it's my pleasure to be with AWPHD again. I have had the pleasure of working with your organization since probably off and on since about, I think 2016 was maybe the first time that I presented for you. I will also be at the meeting this summer in Chelan, so would love to talk with those of you that are interested in a follow-up conversation. I will be also presenting at that session. So more to come. I hope today's conversation really just kind of primes the pump and gets you thinking about a few things. My intention is to kind of provide some opportunity for that further service, further discussion. So I'm going to jump right in. And today's conversation is about board self-assessment, but I want to put it into a context because I think oftentimes board self-assessment gets relegated to one of those kind of check the box activities that somebody told us one point in time we had to do it, and so we're going to do it, but we're not really going to see it as a value add. And I'd like to shift that narrative if I could today. And I want to start off by just addressing the elephant in the room. There is no one currently alive in the workforce in healthcare who's ever dealt with the kind of events that we've dealt with in the last 3 to 4 years. So we are now dealing in unprecedented territory for all of the leaders in healthcare. And I think it's really important that we keep that in mind as we go forward and have conversations. People are still very much hurting. There's huge turnover right now happening in leadership. I see a lot of CEOs resigning, looking for other roles, in part because they feel like they stuck it out through the war of COVID, and now things are, kind of to where they might stay for a while. I won't say normal, but and people are just kind of had what they can stand. So I want to encourage everyone to practice an additional level of kindness and self-awareness, because people are not at their best. And when we're not at our best, we aren't always completely aware of how we're showing up. And so self-assessment is a great way to have a conversation about how the board is doing, how you all are working together, working with your executive leaders and your community, to really try to encourage people to think about things in a little bit different way. I'm looking for the controls here. They tend to go away. Okay, here we go. So starting off, I want to talk about where we are again as an industry. I'm speaking from a standpoint of the financials of the hospital. This comes from a Kaufman Hall National Hospital Flash report. They provide this service to hospitals. There's about 900 hospitals that are included in their data set, and they release this on a monthly basis. So if you're somebody that likes to follow what's going on nationally, financially, I would encourage you to take a look at the Flash report for Kaufman Hall. And basically, Ken Kaufman, the leader of Kaufman Hall, is of the opinion that healthcare has to have a remodel, that we cannot ever go back to how things were. The way that the financials are set is not sustainable, and waiting for a reversion is just a rapidly decaying option. So we're going to be facing a lot of change in healthcare. We're going to have to find new ways of doing things. And in order for us to find new ways of doing things, it's going to be important that our leaders are aligned in kind of their opinion of where they're starting out from. And that's kind of the point of a self-assessment, is it gives you a sense of where are we now as we look forward to where we need to go. And again, another kind of just a context setting slide. This one comes from Standard & Poor, who do the bond rating for those organizations that issue public bonds to the bond market. And this is what they're seeing about our industry. I share this with you because I want you to understand that if you're hearing a lot about challenges in the boardroom and things are really, that your organization is facing some really key different challenges, they're saying that 2023 may be the most challenging year financially for hospitals ever. Like 2022 was the most challenging year for hospitals financially during the pandemic, and 2023 could be even worse. So put on your seatbelts and get ready for some real trying times ahead. The kinds of challenges that our organizations and our leaders are facing are, of course, not just the financial, not just the operational, but also all of these things as well. And so I, again, share these with you because what I observe in working with leadership teams of hospitals and health systems across the United States is that when people are under a particular level of duress, they tend to kind of withdraw and revert to sort of what's comfortable to them. And change is never comfortable. And we've got a big amount of change that we're going to be facing as an industry. And so in order to get us ready for that change, I would suggest to you that one of the things that boards can do kind of within your control, within your locus of control as a board, is to take a pause and say, how are we doing? What is our value add as an organization, as a body that's part of this organization? How are we performing, and how are we contributing to the organization's overall effectiveness? And so when you think about kind of what is the board's role and how the board is contributing, I would suggest to you the first thing that the board can do to be a value add to the organization is to think about what mode are you operating in, and are you aware of what kind of the board's role is? Do you have, is the entire board operating according to what your bylaws or your governing documents, your job description, is everybody operating according to what that says? And then this context comes from a book called Governance as Leadership. And if you like to read about governance, if you're weird like me, then you might consider taking a look at this book. It's an old one, but it is the foundation for a lot of the conversation that you might hear at conferences and from people like me when we talk about generative governance. It comes from this book, Governance as Leadership, and Richard Chait was the primary author of that book. And what gets misunderstood a lot of times is people will say, well, generative governance is sort of suggested as if that's the better form. But really what the book is trying to suggest is that there are different modes of operating as a board, and it's important that you operate in all three. So one of these is not better than another, but you want to spend some time as a board in all the different modes of operating. And the point they make in the book, which I happen to agree with, is that boards spend far fewer amount of time in the generative mode of governance than they do in the strategic or in the fiduciary. And so when we talk about board self-assessment, which is what we're here to talk about today, I could see a board self-assessment exercise being something in each of these three modes. So you could take board self-assessment strictly from a fiduciary standpoint and say, gosh, the regulatory agencies, Joint Commission, or whoever gives your whoever your accrediting body is, they like to see that boards are being mindful of their own performance and that leadership is participating in regular assessments. So we're going to do a board self-assessment because it will check a fiduciary box for us. You could do board self-assessment in a strategic mode of governance because you could think, well, we, the board, want to make a value add. We want to make sure we're contributing to the organization's effectiveness. And so we're going to take a board self-assessment and make sure that we are contributing and working in partnership with our team and with our providers So that's going to be the strategic mode. But you can also think of a board self-assessment in a generative context. And this is the one where it gets a little more fun and also a little bit more kind of hard to describe, but bear with me. The idea that board self-assessment could be in the generative mode of governance is this idea of who are we as a board? Who should we be as a board? What's possible for us as a group of community leaders who are committed and passionate about the mission of this organization and the service to the community? What's possible for how we could collectively and individually make a contribution? And those are kinds of things I just thought that would be fun to play with when you think about board self-assessment, kind of that you could be in each one of these three operating modes. So when you think about conducting a board self-assessment, now usually it starts off with a written survey, and then the board members all complete the survey, and then somebody puts the survey results together, analyzes it, and you have a conversation. And the conversation really, I want to make sure that this, if there's only one thing you take away from the conversation we have today, is this idea that doing a board self-assessment, have people fill out a written survey, but not taking time as a full board to talk about it, is probably like depositing, $1 into a vending machine because you're thirsty, but walking away before you grab the soda. So you really need to make sure that if you're going to do a board self-assessment, you take time at a board meeting or at a board retreat when you've got all the board members there to talk about what the results say. And I shared these questions with you because these came from a board that I worked with in Northern California. They were a private, not-for-profit board. And these were the questions that really emerged as we went through a self-assessment process with them, where everybody filled out a survey. They had hired us, so we did interviews with all the board members, individual interviews, brought it all together. And these were really the questions that kind of rose to the top of the heap. And as a result of having a conversation at a retreat about these questions, the board was able to really kind of move themselves forward, I would say, in a different way than they had been before. And they had really big things in front of them. This particular board had affiliated with a system. The affiliation was not going well, and they subsequently ended up having a very kind of public and messy, corporate divorce, if you will. They had a turnaround CEO in place who had done a good job of turning the organization around financially, but had a very sort of brash and almost abrasive manner that people were having a hard time interacting with their CEO. So these kinds of conversations created a somewhat safe space where we could bring the board members together and talk about what they were going for in that sort of broader sense, so that these other issues that they had to deal with were put into a context that made it worth working through the tough stuff. And I would say every organization out there right now, every hospital or health system board has a lot of tough stuff that they're having to work through. So taking time, even though it seems somewhat counterintuitive, taking a pause to talk about how we're working together can be a more constructive, productive way to spend some time than just about anything else, because it enables you to have that other conversation. The board self-assessment itself, really, if you're going to do it, please, I implore you, make sure that you don't look at this as just we're going to fill out a form and be done with it, because the opportunity that presents itself here is really one of the change of really turbocharging change management. Every board member that I've spoken with in 25 plus years, CEOs that I've spoken with, there's always something about the way the board is functioning or operating that you could imagine being better than it is. I mean, many boards operate at a pretty good level of governance, but there's always something that if you had a magic wand that you might say, gosh, I wish we could do that a little differently. when you have a good board self-assessment process, you ask the questions about those things that maybe you personally think could be a little better. If other board members are in agreement with that, then you have a conversation about, okay, how do we do this differently? How do we do this better? And that is really the essence of change management, is creating a sense of ownership among the people whose behavior you ultimately need to influence or change, that they say, you know what, it isn't a consultant from the outside telling me I need to do this differently. It isn't the CEO trying to micromanage the board, telling me, it's the board members themselves saying, hey, you know what, the way that we're running our board meetings right now, it could be better, and we want to structure our agendas a little bit differently. We want to see different kinds of board meeting materials. We want to focus our discussions a little bit differently, that sort of thing. So it's a great opportunity, if you take it from that perspective, to figure out what you could do even better. And, you know, as leaders of healthcare organizations, the first and foremost role that you play is to ensure that there is an effective and safe care structure, care management process in place, overseeing the quality of care that's being provided to the members of your community is really critical. And if you read literature on healthcare quality, they'll talk to you about the importance of a culture of safety. And a culture of safety, always one of the things that gets baked into the handful of items that are most important, is regular assessment. So as a board, even though you're not necessarily assessing your clinical competencies, because of course that's not what you do as a board, the fact that you are regularly assessing your own performance sends a signal to the rest of the organization that we are leaders who are going to follow the same kinds of processes that others in the organization follow when they do the regular assessment that's required. The medical staff is assessing other colleagues for clinical care, and the board is assessing its own effectiveness. The key elements of the self-assessment process: make sure that the questions you ask focus on the job that the board has. So these areas here that we've spelled out: oversight of quality, oversight of finance, advocacy, and maybe community relations, management, board effectiveness. Those are the things that I might suggest to you are the buckets of work that are obligations, the things your board should be focusing on or doing. But it's most important that you think through with your board, how do you define your job? And again, it's one of those things where a self-assessment creates an opportunity for a broader conversation that's really important to have, is what do you think you're supposed to be doing as a board? A lot of times, boards I work with, a lack of clarity around that exact question creates all sorts of challenges for not just the board, but the CEO and the organization as a whole. So the way to start off a self-assessment process is to have a conversation about what are the areas we're going to assess. Look at your governing documents. If you have a job description, if you have something written that says this is the response, we have board policy book. Look at your board policy book and say, here are the things that our board policy book says we're going to do. Let's see how we think we're doing on those things. I suggest that what you do is create a written survey of questions. Make most of them, I would say, closed-ended. Use a 5-point response scale. So, strong, make them statements, and then have people say they strongly agree to strongly disagree. Have the strongly agree be a 5. And then that gives you an ability to create a numerical response and create some averages. And if you can, use the same survey for a couple of years in a row so that you can see how you're trending as an organization. You can see how you're trending as a board. We have a client up in Alaska that we have had the privilege of working with for nearly 10 years. And it's been amazing to see the evolution of their assessment of their own performance. And I would say, as an outsider, my assessment of their performance, and it isn't just that they did a board self-assessment, but the board self-assessment helped them have the conversation about the other things that they wanted to do differently. And so that in turn has created this sort of virtuous cycle. And it's wonderful to see the self-assessments, the year-over-year reports that we have to show what the board members think and how their progress has changed. Here I'm giving you just kind of like what the 5 levels could be for those closed-ended questions that you have. And I know maybe this seems like stating the obvious, but I worked with a different board up in Alaska, and they had done their CEO performance evaluation and they stopped at a 3. So basically it was, performance evaluation. So it was like, below expectations, needs improvement, meets expectations, and that was it. They didn't go up to like exceeds expectations. So I felt badly for the CEO because his evaluation, the best he could do was meets expectations. So anyways, I just suggest to you, make sure that you give yourself enough of a range so that you can see where people really fall in their assessment of their performance as a board. I know in some of your minds, you may be thinking, well, what about individual board member assessment? And if that's something that your board has the appetite for, I would say by all means, go for it. We have worked with clients where they've done assessments of individual board members, but I would suggest to you that may be an advanced practice. So if you have not previously been doing board self-assessment, start with just a general assessment of the board's functioning as a whole, and use that for the conversation, because the other issues that you think you might want to get to with individual assessments, those do come out in the conversation if you just do an assessment of the board as a whole, especially with public hospital districts. You've got elected officials at the table, and so individual assessments, I think, may be less appropriate or even more challenging to contemplate. But just doing an assessment of the board as a total board still will help you get to some of those thorny issues where if you've got some individuals who choose to do things differently in a way that causes some conflict for others, those issues, you'll have a chance to discuss them if you kind of ask the right questions. One of the things, as I mentioned earlier, how you bring the information forward in summary is really critically important. So again, it's not just that you took the time to ask the questions and had people fill out surveys. What did you do with that information? How are you bringing it back to the board members? So what we have here are just 2 different ways that we have shared information back with boards in the past. And on the left, what you'll see here is a board that we've worked with over 5 years there. And so each one of the years where we've done their assessment, you can see what the scores are for the board members' agreement, strongly disagree to strongly agree on average to the statements that you see there. And that's just a selection of statements that we used in this particular board. So if you have trended data over time, it's great to see. You can see the variation and changes of responses, and you can talk about that as a group about why scores have gone up or gone down from year to year. And oftentimes there's a very specific instance or situation that's caused board members to change their opinion about how they're doing on any one of these statements. What you see on the right, though, is for a board who only has done it for 1 year, but what you've got is both the average of the responses, but also the number of responses in each category. And I think this is really important because it displays the range of opinions that the board members have about performance. And what I like about this far right way of showing where you've got the bars, you've got 11 green, 7 of the light green, 1 of the orange, and 1 of the yellow. It shows you when board members have disagreements with each other. So if you had an average of a neutral response on a particular statement, do you have that neutral response because the entire board feels your performance is kind of neutral in that regard? Or do you have a neutral response as average because half of the board strongly agrees with a statement that you're doing well and half of the board strongly disagrees. Those are two very different conversations to have at a board. So it's useful to have what we've got on the right there, which is sort of a frequency of responses. And I would suggest that having both is useful as you bring the data back. One of the things that I spend a lot of my time when I'm consulting with boards talking about is helping board members understand each other's points of view, because as a board, you only have authority when you're called together in a board meeting. You don't individually have board member authority. You don't individually have authority to make things happen or do things. You only have authority to do things as a single body. And so making sure that there's alignment and understanding among all the board members is even more important than any other type of team or group that you might be working with, because it's kind of like a sack potato race, or the three-legged race where your legs are tied together. You have to, in order for you to make progress, you're going to have to be stepping in a pretty good kind of cadence with each other. And so knowing where you're out of step with each other in terms of your opinions gives you an opportunity to talk that through. Let's see, keep us moving here. All right. Once you've done the board self-assessment survey and you've kind of created, and there are lots of surveys available out there online. There's lots of questions that you could identify. Different organizations have put board self-assessment questions for hospital boards or public hospital district boards out there. It's not hard to find a set of questions to use. But I think what I would suggest to you is the power is in looking through those questions and determining if they're the right questions for your board, and if they cover the areas of responsibility that your board sees as its areas of responsibility. So you've got the survey created, you've got the survey administered, you hopefully got 100% of the board members to fill it out. Sometimes if I work with a board and they don't get 100% of the board members to complete the survey, that in itself is useful information, and we can have a conversation about that. But ideally, 100% of the board members complete it. You get the report. What do you do with it now? I really suggest this is where the conversation comes in, and this is where you dedicate time. In my perfect world, you schedule a half a day or a full day board retreat, and you use this self-assessment as the reason, as the topics, to identify the topics of conversation. So for instance, if you're able to schedule a half-day retreat and your board has done a self-assessment and you've got the meeting evaluate, you've got the results of your self-assessment, and the board looked at all the different areas of its responsibility. The area that it rated itself the lowest in perhaps was quality oversight. Maybe you've got board members who don't have a clinical or healthcare background and they don't feel that they do as well in quality oversight. Well, then you know that your board retreat can spend an hour or two focused on the board's quality oversight roles and how medical staff credentialing and privileging works and why it's important. You could have your chief medical officer, your chief quality officer come and talk to you about that. So it gives you kind of the agenda for the retreat itself can come from the areas in the board self-assessment that the board has identified that it needs more information or more discussion on. You also would spend time in your retreat talking about how your board is operating, how you're working with each other, where there are areas where some board members thought you were doing really well and some board members didn't think you were doing as well. Why are they having those different perspectives? What is it that the board members who think they're doing well in a particular area, what do they think they're doing well there? What are the ones that think it's not performing as well? What are their concerns? And coming together on those and giving people a chance to hear each other's opinion is really, really important, because too often board meetings tend to be sort of a spectator sport, and governing is not intended to be a spectator sport. If you spend 90% of your board meetings sitting there listening to presentations, then perhaps that's an opportunity for some revision in your board meeting agendas. And perhaps that's an opportunity for how can we restructure our work so that we are engaging with each other more and engaging with the topics and the important issues more rather than just listening to presentations. So board retreat gives you a chance to create that space for conversation. And then maybe in follow-up, what's the third box here that I would suggest is that you design a board action plan. So there's going to be a few things perhaps that come out of the board retreat where you say, gosh, yeah, we really could, we really need more guidance and, in agreement on how we're going to do things as a board. But right now our board policy manual doesn't give us that guidance, or it's not as clear as it could be in describing the work that we want to do or need to do as a board. And so one of the follow-up action plan items could be, we're going to charge a subset of our board, maybe a governance committee if you have one, or just, someone who volunteers to work with the leadership or your board liaison or your board clerk to revise that part of the board policy book and bring it back to the board. So that would be an item on your board action plan, for instance. And then you can create a process where you're talking about the issues that came up in your board self-assessment on a maybe quarterly basis, or at least on a biannual basis, so that you see that change is going to actually be made. Because, I think the quote is attributed to Einstein. I don't know if it really is his or not, but the idea that, doing the same thing over and over and expecting a different result is the definition of insanity. And so there is, if you're going to take the time to do a board self-assessment, which I hope you will consider, and obviously what I'm recommending, if you don't decide to do something as a result of the board self-assessment, then it wasn't necessarily time well spent. So the action plan is the agreement of what we're going to do about what we talked about at our retreat. And so here you have some examples of a couple of items that one client that we work with decided they want to do as a result of their board self-assessment and their board retreat discussion is they want to review their board policy on orienting new members and consider updating it or enhancing it. This particular client has had good tenure in their board seats. They have had the same board members for a while, which is terrific, but there's the idea that they may be getting some newer, different board members in the upcoming elections. And so they want to make sure that they've got a good orientation process in place. Board self-assessment is not just for those boards that are struggling or think they need to improve things. It's also for boards that are doing quite well, and we need to capture what you're doing well and build it into board policies or bake it into the processes that the board follows so that the highly effective ways in which you're operating as a board continue to exist beyond your tenure on the board. Isn't that what we all hope for, is to leave a legacy behind us of the organization being in an even better spot than it was when we joined? And so one of the ways you can do that as a board member is by going through a regular process of self-assessment, figuring out what you're doing well, and then figuring out how do we capture that and bake that into our structure, processes, policies, procedures, so that folks who come after us know how they can do similarly good work in those areas where we are strong. And in addition to a board action plan, what you might consider, and this is sort of my little kind of throw it out here, is this annual board work plan, because I think too often boards are focused on solely or, almost exclusively on the work of the organization itself. And while that, of course, is why we're all here, to make sure that the community's healthcare needs are being well served, that the hospital is being well run, that the clinics are seeing as many patients as they can, that we're providing the services that the organization, that the community needs from us. Of course, those are the things that you want to spend probably the majority of your time on, but you do need to spend a little bit of time talking about how are we as a board functioning and what are the things that we need to be doing as a board to be able to make sure that we perform at a high level. And again, this is all part of that, building that culture of accountability and a positive organizational culture. It really does start at the top. And so if your employees, if your doctors and nurses, your executives, if they see the board taking seriously its own work and being thoughtful and methodical about the way that you approach governance, then they will understand that that's what we do at this organization. And so this is an example of a board's plans for the year. And it basically is just, this is kind of where we go when we start to build their board meeting agenda. This particular board that you're looking at, they have bi-monthly meetings, so they don't meet every single month. But the months where they don't meet, they have an education session, and it's focused on usually just a single topic. The board doesn't take any action. It's optional if there are board members that are not able to attend. They are not required, although most of them do attend every one of the education sessions. And so what you see here is that this board, in January, it was going to review the results of the assessment, the board self-assessment results, which were, completed the previous fall. They're going to talk about the chief executive's annual goals for her performance evaluation. And then in February, they had a great presentation on community health and the community health needs assessment that they do. March board meeting, they had a bylaws review task force doing some work that came back and reported. They talked about creating a nominating committee, which they hadn't formalized previously. So you can see this basically just lays out for the year. And this way you make sure that all the things that need to happen during the course of the year are happening. And it gives you a sense of how full any particular board meeting is going to be. Because one of the things that just about every board that I work with struggles with is board meetings that are just way too full. And so by looking at the work plan, you can kind of anticipate, gosh, March is looking a little full with the things we have, but May is not as full. So perhaps we can take that one item from the March board meeting and put that on the May board meeting agenda. And that way we make sure we reserve enough time in March to actually have a good conversation. So those are the things that can come out of a board self-assessment, is this idea that we want to be thoughtful and structured in the way that we approach our own work as a board. And it signals and creates that sort of positive dynamic and the positive board culture that, to my mind, really is the gold standard of effective governance. And I think, kind of to that point of building that board culture, one of the things that I find most valuable about the board self-assessment process is that it gives people a chance to talk about things that are sometimes quite difficult, how they're getting along with each other, how one board member's behavior is driving another board member absolutely crazy. And it creates a container and a structure for it that isn't just a finger pointing, moment of ire, I can't stand it anymore. It's actually a conversation about how is this affecting our overall productivity as a board, and how can we work together better? Because that, in the end of the day, I think is what we all are striving for. And coming back around to where we started, healthcare is in an incredible period of stress and transition and change. And so we need our leaders to be operating at the top of their license, if you will. Forgive me the sort of analogy, but we as board members need to make sure that we are bringing our very best selves and our very best ways of operating to the board table, because what's going to be required of us in the kinds of really difficult decisions that we're going to be facing is going to be something I don't think we've seen before. And this isn't for the faint of heart. And while board members are your elected officials, you volunteered for this, but this is, so it's a volunteer role to a certain degree, but this is not a role for amateurs. And so that idea of constantly seeking to improve ourselves, our performance, constantly seeking education, those are the things I think that are really going to be essential, and ways that you as individual commissioners can have within your control to do well. And it isn't, it isn't the end all be all. This is not a panacea, but I have seen how board self-assessment when done in a way that's thoughtful and with the intention of being impactful and part of a change management process, it really can transform an organization's board culture over time. And that, as we know, has a tremendous impact on the organization's culture. So those were the comments I had prepared. I know I kind of just put a lot out there, but I'm curious, folks who are there, questions, comments. Matt, if you want to jump in, anything I missed or you want to elaborate on, I'd love to have you join me.
Well, thank you so much, Carmen. What a tremendous amount of information, and I love the toolkits and particularly the work plan checklist. I know here at AWPHD, for those boards that are doing the self-assessment work, they call AWPHD to call in and do those education sessions. And it's always a resource we have available, and we're thankful and grateful for the invitation to do so. And of course, would extend it to the folks here on this call. We don't have questions coming in on the chat. I know a few may have come in to Joanna via email. And so I want to thank you all for that. You know, another thing I do want to say, other than thanking all of you for attending, you know, preparing for the future by knowing your present state, the importance of regular board assessments. You know, we're going to continue this conversation with our AWPHD membership. I know some of you may be attending our leadership conference in Chelan. You're going to see Karma there. She's going to be giving another governance presentation. And don't be surprised if you see some of these themes carry over for some further discussion. And for those of you that are going to be in Chelan, I'd really encourage you to reach out to Karma and find some time in a cup of coffee, or, you know, rumor has it there's a big lake and there's going to be some sunshine, and go sit out and have some iced tea and sit by the lake and visit a little further with Karma about how these assessments work and extend that conversation. As a reminder for those of you that are working toward earning that healthcare governance certification, you've earned a credit hour today. And this credit will automatically be logged into our learning management system. Moving forward, you'll register for and access all government education webinars via that portal. Keep an eye out for more emails from gov.edu at wisha.org for more information about the portal. And if you have any further questions or would like to provide feedback on the course, please feel free to email us at that same address. Final reminder, to the commissioner survey is due to AWPHD by May 31st. That handy link is still in the chat, and we appreciate your participation there. Thank you again for joining us, and we wish everybody a great day.
Thank you so much, everyone. Great to see you. Look forward to seeing you in Chelan. The slides will be sent out. Joanna's going to send the slides out by email. So we'll have those available to you. And if I can help in any way, please feel free to reach out, and look forward to seeing you there. Thank you for your time today. And thank you for what you're doing to serve your communities. It's really valuable and very important. And I know it's not always an easy job.
Great. Best of days to you all. Thank you for participating.